we might as well go ahead and get started. I don't know how many of you are familiar with Wild Virginia, but just in case you aren't, I wanted to tell you just very, very briefly about us. The best way to find out about our campaigns is to go to our website, which is listed here, www.wildvirginia.org. So really easy to remember. And when you go there, you can find out a lot about our programs. There are blogs, there are links to lots of things, and it's the best way. But we exist to protect and connect your favorite wild places. And that may mean your favorite wild place may be the park down the street. It may be Shenandoah National Park. It may be the National Forest. It's different for everybody, but all of those places are truly important. And the ways that we're working to do this right now are through two main campaigns. One is habitat connectivity, and the other is water quality. And if you're here tonight to hear about PFAS, you clearly are interested and understand the importance of water quality. One of the things that we're proud of with our habitat connectivity campaign is by being one of the leaders of the Virginia Safe Wildlife Corridors Collaborative. And this is a group of over 40 different organizations that are working together. The key word in this is collaborative, working together to find ways to allow wildlife to move safely through our landscape. And there is an upcoming webinar next week on Tuesday at 6:30, which will talk about black bears. And our guest is from the Department of Wildlife Resources, and she'll be talking both about black bears and their lifestyles, but also about some of the threats to them. And one of those threats, of course, includes a lack of connectivity. So how important it is for these large animals to be able to move safely through the landscape. So we hope that you can join us for that. And then I also wanted to put a plug in for a program that we're really proud of, also really proud of. It's the Clean Water Advocates Program. And this is designed to help any of us get the skills to advocate for our favorite waters. And it's an online program. The enrollment will be going on throughout June. And there will be also a webinar there to learn more about that program. But it really is designed to give people the tools to be able to advocate for the water that is near them or that matters the most to them. And then, of course, an important part of water quality and an important part of what Wild Virginia does is to work to prevent PFAS pollution. And I want to introduce the people that we have here today, one of which is Kylie McClatchy, who is our support and communications coordinator. And she is the person that makes sure that everything runs smoothly. And then David Sly, who is our water quality program director, and he's going to say a couple of words in just a minute. And then when he's done telling you about what Wild Virginia is doing, I will introduce our speaker for the night, Dr. Laura Anderko. So I'm going to stop sharing my screen and give Dave a chance to talk.
Thanks, Betty. Um, yes, so Betty mentioned our overall water quality program. I'm water quality program director, and our overall approach in general is to try to get those environmental laws that already exist be fully enforced and implemented, because those are tools that are available right now. And that's the same approach that we've taken with PFAS from the very beginning. One thing that we're concerned about that people look at PFAS and how widespread it is and how it's affected so many parts of our lives, and we're all involved with it one way or another, was that people would be discouraged and say, well, it's so big, what can I do? Well, the fact is there's something very practical we can do, and that is to stop certain sources of it from being released into the environment. Uh, Primarily, our focus is on discharges of wastewater from municipal wastewater plants and from industries. And those dischargers have to have permits granted by the state under the Clean Water Act and state law. There is no excuse for not controlling PFAS when it is being released to our streams and our waters in that fashion. So that's one thing we're advocating, that the permits that are going to be issued have the proper monitoring, the proper requirements to keep those releases from being made. Another way that it's getting into the environment is through the spreading of sewage sludge, basically the solid or semi-solid materials that come out of wastewater treatment plants. And if you don't know, the fact is that it's spread widely across our farmlands, across the state, and across the U.S. And it can be a very serious source of PFAS. So in those realms and in others, if we can stop it at that part of the process, hopefully we can go back upstream, if you will, and put some pressure on to stop using it, stop creating it. And that's what has to happen in the end. But we take what we think is a very practical approach, and we encourage you to join us in it. So. If you haven't known about us before, now you do. So you'll be looking for our opportunities to weigh in on some of these issues. Thanks.
Thanks, Dave. Okay, so now I'll introduce our speaker for tonight. Um, so um, Laura has been a participant in Wild Virginia's book club for a long time, and I did not know that she had this expertise in environmental health and in PFAS until one of the books that we read in book club was called They Poisoned the World, and it's by an author named Mariah Blake, and it's about a town in upstate New York and their fight against PFAS in their waters. And Laura was coming to book club, and she very generously agreed to volunteered to share her knowledge with the people who were at book club. And that made us think, well, not everyone comes to book club, so this would be an opportunity for her to share her knowledge with a much bigger group of Wild Virginians. So let me tell you a little bit about Laura's background. She's currently an environmental health nurse consultant, but she is retired from a professorship at Georgetown, where she was the Scanlon Endowed Chair in Values-Based Healthcare. She was a professor and the PI director of the Mid-Atlantic Center for Children's Health and the Environment. She's been working on environmental health issues for over 40 years. She's published many, many articles on health topics, including climate change, served on various boards and federal advisory committees, and recently was a member of a committee that the National Academy of Sciences, Engineering, and Medicine put together to publish guidance on PFAS testing and health outcomes. She's received many awards for her work, one of which was being recognized by the Obama White House as a champion of change for her advocacy efforts in climate change and public health. So without taking any more time, I'd like to turn it over to Laura.
Thanks, Betty. And thanks, Dave. I first met Dave, for those of you thinking about being a clean water advocate, during some community events to talk about what he mentioned, discharges and policies to help protect our water. I'm really happy to be here, and I thank everyone for coming to hear about this really important topic. I think I'll go through the presentation and then hold some time for questions. Would it be helpful, Betty, if they just put the questions in the chat box?
Yes, that would be perfect.
Okay.
And then I will, are you okay if someone asks a question that's really sort of timely, like related to a slide that you have up? Is it okay if I?
Sure, it's fine. Yeah, it's fine. Absolutely.
But we'll mostly try to save things for the end.
Yeah, I don't want to go over the time allotment.
Right.
But sure, let's do it that way too. So tonight we're going to go through a series of topics. One is first learning about PFAS. What are they? Most of us know them as forever chemicals, but why are they called forever chemicals? And common exposure pathways, Dave talked about biosolids. We'll talk a bit about that as another way for us to be exposed. Also, the potential health effects. We're learning more and more since the report came out in 2022, the National Academy of Sciences report. And we're also going to discuss ways to reduce our exposure. there's always something we can do, right? Always something we can do. So what are PFAS? Currently, it's a family of over 14,000 synthetic chemicals. Um, they were developed in the late 1930s. They're known as forever chemicals because they stay in our body for a long time. It takes a long time for our body to get rid of them, and we'll go in more detail about that later. Why are they used so extensively? Well, they are heat resistant, oil resistant, stain resistant, grease resistant, water resistant. So they're in a lot of products, and we'll cover some of those. The tree on the right actually was developed by the CDC, the Agency for Toxic Resources, and oh my gosh, ATSCR. And the PFAS on the bottom, this is what all these chemicals used to be called. So if you're of a certain age, you may remember them being called PFCs, but now we are more specific about the kind of PFAS. There's carbon fluorine chains, carbon chains, and they're bound with fluorine, very difficult to break, and they're called long chain or short chain. The fact of the matter is the short chain we're finding out they're not any safer than the long chain. They may get out of our body quicker, but they still do a fair amount of damage to our health. So as Betty mentioned, this is the book, They Poison the World by Mariah Blake. I've been working on PFAS and health for 11 years at least now, and there were a lot of things in that book I didn't know historically about how tied in these corporations are with the military and the war efforts, and how a lot of these chemicals are developed in response to building weapons. And I would suggest if you have any interest at all in the history, to pick up the book. It's really a pretty quick read, and it's some parts are pretty horrifying, actually. I also want to talk about the two films briefly, just mention them. The Devil We Know and Dark Waters. You can get those through streaming. There are a lot of films out there on PFAS, but these films really talk about the cover-up by DuPont and 3M, how communities were impacted by the PFAS in the water, and it gives you an entertaining sort of look at the history. So I won't go through this entirely, but what I do want to point out is that, as I said, in the 1930s, late 1930s, it was invented by mistake. And it was quickly used to create Teflon pans. And I grew up when Teflon pans were the thing to have, right? You didn't have to use butter or oil. You just throw it in there and it slides right off. Well, once that was discovered as being a commodity, that it really began to be produced and used for stain and water resistant products, firefighting foam, AFFF firefighting foam, which can get into our water. It's used in Air Force bases and all sorts of places where, obviously firefighters use them, but it's not regulated and it can get into the water pretty easily. Waterproof fabrics, and on and on. And so I do want to point out the gray square on the right, where the government asked the primary industries like 3M and DuPont if they would voluntarily stop producing some of the earlier PFAS, the PFOA and the PFAS. And what happened, and they agreed to do it because they were developing new ones, is take a look at this graph. You see the green line, that's PFAS. And in 2002, they stopped producing. It took a while, but you can see that the levels came way down in human blood. Now, the fact of the matter is over 97% of us in the US have some amount and type of PFAS in our bloodstream. Some would say 99%. So something to think about, as Dave said, we need to stop making these chemicals and letting them get into our environment. So why is this important? The CDC made the slide back in 2022, 4 years ahead. We now know that it's more than just a contaminant of emerging concern, which is how EPA described it. In fact, during the Biden administration, they regulated 6 PFAS and or combinations of PFAS for public drinking water systems to regulate by 2029. The Trump administration has extended that to 2031. But the point is that the government doesn't regulate unless they're seriously concerned about their effects. There's widespread human exposure, as I said. It does bioaccumulate in people. It says may, but the reality is that these stay in our systems for upwards to 35 years once we get exposed. And so they just build up over time. It can affect the developing fetus and child, and there's more and more research to show neurological problems. It's being linked to ADHD, and we'll talk a bit more about some of that emerging science towards the end. It can increase cancer risks, testicular, thyroid, breast. There's long half-lives in humans, and the next slide will go into some of the PFAS and how long they can last. And then finally, PFAS levels have exceeded the EPA's lifetime health advisory in drinking water in several states. And we'll have maps that show what the extent of it is, particularly in our state here in Virginia. So how long do PFAS remain in the body? So these are the biological half-lives, meaning that it takes this long for half of the substance to be metabolized or eliminated by our body. So the longest is 35 years, 4.7 to 35 years. The shortest is 72 to 81 hours. So the shorter chain tend to have a shorter half-life. They don't stick around in the body as long, but some of them can last for years. And again, if we're consuming water with PFAS in it, if we're eating food, if we're breathing the air, if we're eating fish with PFAS in it, it all builds up over time. I'm not going to go through this in detail. This is a report that Betty had mentioned, done by the National Academies. I was a member of that committee. We were commissioned by the government, the National Academies was, to come up with a review of the literature of the science on the health, human health, looking at how people might be tested for this and how health providers might treat or test or be guided clinically if someone has a high level. This came after a lot of community complaints to the government about some of the cover-ups, particularly in the Northeast, people that were getting sick and dying. Part of the committee work was listening, going to town halls and listening to folks who told their stories about husbands who were firefighters who died from cancer, and just really very sad stories. And so we took all of this information and came up with this report with clinical guidelines for clinicians. The CDC then took this report and sort of modified our recommendations, which the communities were not terribly happy about because they were too broad, they felt, for the issues that people were facing once they were exposed. So what are some of these exposure pathways? If you look on the left, you'll see PFAS producing or using industries. They, of course, will produce wastewater. Some of this goes directly into our rivers and groundwater. Some of it goes to wastewater treatment plants. Once it gets processed through the treatment plant, that can also get discharged into our waterways. But as Dave mentioned earlier, it can go into what's called biosolids or sludge. Biosolids are really an important exposure point because it's put on our farmlands and it can enter our food. In fact, if you have a garden at home and you have high levels of PFAS in your water, and you're watering your garden, the plants can uptake that PFAS. And so that's a real concern. Also, the biosolids will at some point infiltrate into the groundwater, those PFAS chemicals. And then on the top right, we see residential homes. We purchase a lot of products that have PFAS in them or were treated with PFAS, and also food packaging. Keep in mind that it's grease resistant, so you're going to find it in French fries boxes, pizza boxes, things like that. And then last but not least is the firefighting foam, sort of in the lower middle of the screen. This is a real problem around military bases and airports where they do a lot of training. My first town hall when I was director of the Children's Environmental Health Center was up in Willow Grove, Pennsylvania, which is a military base, and people had found out that their wells were polluted from the runoff from the military bases. And they were given bottled water, and we know bottled water isn't great either because of the microplastics and other things, but that's a whole nother lecture, so I'll stop there. Okay, so this side, in the center, we have our drinking water, which is a major source of exposure for us. We have to drink water, right? And if there's PFAS in our water, we're going to get it in our bodies. On the left is a fish. Again, if the fish are in water that is polluted, they're gonna take in those pollutants. And so again, in the Northeast, there are a lot of warnings to folks about fishing, eating fish that they catch, as well as deer hunters being warned that the deer that they were testing had very high levels of PFAS in them. Above the fish is furniture, upholstered furniture that is treated, stain-resistant. Scotchgard is a popular brand. Above that are healthcare tools, if you will, and implements. This is a stent. There's IV tubing and IV bags and bandages and masks that we wore during COVID that's coated in PFAS chemicals. And there are a lot of groups looking at how to prioritize which products are important for PFAS and which are not. And the healthcare items are the ones that are pretty high up on the list, as you might imagine. Above that is stain-resistant carpeting. Again, keep in mind that these products like upholstered furniture and carpeting, these all flake off, right? And create dust. And dust can be highly toxic depending on what's in your home. Water-resistant clothing, firefighting foam, our famous nonstick cookware, and dental floss, the Easy Glide dental floss. And the lower right-hand corner, makeup. There's a lot of makeup with PFAS in it. There is a bill that was passed recently in our state that manufacturers have to put on the label what's in there if there's PFAS in there. Powder, liquid makeup, mascara, all those things. And then in the center are menstrual products. tampons, pads, and right above that is our famous French fries box. But it goes for all sorts of things, primarily fast food, of course, right? We know that PFAS and PFOA, two of the many chemicals, PFAS chemicals, are also commonly found in the breast milk and the cord blood. All right. And so there's lots of research going on looking at the impacts on the offspring. Right now, the health agencies are still recommending that breast milk is better than formula. If you have concerns, if you're pregnant or you're breastfeeding, please talk to your health provider. There's a caveat. They probably don't know much about PFAS. But if you pull up that NASEM report, it's free. You can take a look in there, and that could be a good talking point with your health provider. And last but not least, our lovely data centers have one more thing going against them, and they have a PFAS problem. These are photographs of Virginia's Loudoun County data centers. And they use, yes, forever chemicals to cool computers. They actually submerge the computers in this chemical fluid to cool them off. And of course, these liquids can leak or seep into our water, whether it's drinking water or whether it's used for agriculture. Another way that PFAS chemicals are used is through the semiconductor manufacturing, with over 1,000 applications in the chip supply chain. So because drinking water is one of the really important exposure points, I just wanted to just highlight some of what we know as far as contamination. So back in 2023, the EPA revealed that 26 million people have forever chemicals in their drinking water. The EPA has what's called unregulated contaminant monitoring rule. And the fifth report required water utilities to test for 29 different PFAS chemicals. Now, I do need to say that as we move along in this presentation, keep in mind that if you're in a public drinking water system, if that's where you get your water, you should be getting an annual drinking water report, which will report on the PFAS levels. That's how I found out my levels were high. I get some of my water from Occoquan Reservoir and the Potomac. And because of that connection with the Occoquan, our levels were high. The EPA also, and if you have a well, if you live in a rural community or have a well for your drinking water, happily there's a new policy in the state of Virginia, and I'll talk about it in later on, that it's a PFAS testing and PFAS testing program and remediation, where they will help homeowners test and then help them remediate if they can, if their levels are high in their wells. And then finally, EPA did confirm the presence of PFAS in 431 water systems at levels above the minimum reporting limits. That 4 parts per trillion is kind of what the Biden administration was using. This was consistent with a study done way back in 2020, published again by the Environmental Working Group, that estimated more than 200 million Americans could have PFAS in their drinking water. EWG.org, that's their little logo up there, does a lot of testing and mapping. They also do a lot of this with Northeastern University. There is, I failed to mention, Betty had posted a PDF on resources. All of these links and everything are in that, that document. So if you want to follow up and look up more information, it's all there on the sheet. So they found back in 2026, February, that over 9,000 sites had high levels of PFAS in all 50 states, in the District of Columbia, and in 4 territories. So I put if you see in the upper right-hand corner sort of here, you can type your address in, and this is the link. This is also on the resource guide. You put your address in, and it'll tell you all the areas close to where you live and whether the drinking water is above the proposed limit, below the proposed limit, if there's any military bases or other known sites that might be spewing out PFAS. Apologies to anybody that lives below Fredericksburg. That's as big as I could get in my screenshot. But you can see that there's a fair number, okay? But wait, there's more. This is the presumptive PFAS contamination sites. This is through Project PFAS out of Northeastern University. And based on outputs, what industries are producing, you can see on the right what all color dots mean, right? So we've got the industrial facilities that are pink, wastewater treatment plants that are light blue, military sites that are green, major airports that are purple, those that handle waste, light blue again, and other AFFF discharge sites, which is a firefighting foam, which is purple. So a lot more than what that map showed. So chances are pretty good that this map is probably a little closer to reality. So health effects. I just read this report. I thought it was fascinating. The state of Washington has put together the costs of PFAS, and they found that diseases attributed to PFAS cost an estimated $5.52 billion each year to patients, insurance companies, and government healthcare in the US. That's a lot of money. How does PFAS get into our bodies? What happens? Well, it binds to our tissue proteins, such as blood, liver, kidneys, and our brain. Most PFAS are not metabolized by the body. The body doesn't know what to do with it. So eventually it will be excreted through urine. All right. The shorter chain, less carbon and fluorine sort of bonds tend to be eliminated faster than the longer chain. And the elimination rates appear to be different in males than females because it binds to blood, right? Binds to breast milk. And it goes through the cord blood through the placenta into the cord blood. So women are more likely to excrete during pregnancy, menstruation, and breastfeeding. So we tend to see higher levels in men for that reason. Okay, so the 2022 report done by the National Academies of Sciences found, and we looked at thousands of pieces of research. It took us a couple years, actually. But what we found with high confidence was there was a decreased antibody response for both children and adults. What does that mean? That means if you get a COVID exam or immunization, the body's not going to take up that vaccine as readily if you have high levels of PFAS. Why? Because PFAS chemicals suppress your immune system. They're immunosuppressive. They tested this on measles, mumps, and rubella vaccines. They tested this on COVID vaccines, consistent across the board. Dyslipidemia or high cholesterol, both in children and adults. Kidney cancer, primarily in adults. Again, it's being excreted by the kidney primarily, right? And so it has a lot of work to do. And then decreased infant, fetal, and growth. And there's some new research that really expands that even more that we'll talk about in just a minute. So the next level is a moderate level of confidence. I can say that the liver enzyme alterations, there's new research out that would probably bring that to high confidence. The liver enzyme alterations, we're finding that there are many issues related to high levels of PFAS and even not very high levels of PFAS where liver enzymes can be altered. I am one of the victims of this, I will tell you. And talked to my doctor, and she said, just tell me what to order. And my blood test was high. It wasn't super high, but it was high. And I do have some issues with my liver enzymes in my liver, unfortunately. Anyway, and also an increased risk of pregnancy-induced hypertension. What does that mean? When you're pregnant, you don't want to have high blood pressure. It's bad for the baby and it's bad for the mom. PFAS, high levels of PFAS can lead to extremely high levels of blood pressure, which can put a strain on both the baby and the mom. Other things that are moderate confidence, an increased risk of breast cancer, increased risk of testicular cancer. The military did, I think it was the Air Force did a test on thousands of military personnel and found a significant association between PFAS levels and testicular cancer. That came out after this report. Also, thyroid disease and dysfunction. Thyroid cancer is now being linked with high levels of PFAS and ulcerative colitis. So some, but not all, of the emerging research includes a decrease in our bone mineral density. So we're seeing people with fragile bones, obviously, acute lymphoblastic leukemia, particularly in children, thyroid cancer, as I mentioned, liver damage, such as non-alcoholic fatty liver disease, pregnant women who have high levels of PFAS chemicals also are being shown to have an increased risk of giving birth prematurely. And obviously, this can lead to an increased risk of infant mortality. So, what do we do? Okay, so first of all, we need to think about where we might be getting exposed. There's all sorts of tools. You can look up environmental exposure history and do checklists and all that. But just think about, first of all, test your water or find your water quality report. Just Google it. You'll find it. Water quality report, county, whatever. Find out what your levels are. Think about any occupational exposures you may have, whether it's, as a healthcare worker in a factory that may be producing this or using those chemicals to produce something, firefighters, military personnel. Think about whether or not you may be exposed. Exposures to certain personal care products, fish. Do you eat a lot of fish? And don't be sold by the fact that it's farm raised and special. That is not good fish to eat. Okay, so wild fish is always the best fish. There's a whole nother hour I can speak about fish, but anyway, think about where you're catching your fish and make sure to look for advisories. There's something called a PFAS blood estimation tool. On the next slide, we'll talk us through a couple points about that. You can do it online. It's free. It's through the CDC. You don't need a blood test, but it will tell you whether or not your levels are high. And I did that after I found out we had high levels of PFAS in our water. And I was at risk. So then I went to the doctor and I had all these other things going on that made me think that maybe it was PFAS, the liver enzyme. So blood tests are recommended for people that believe they've been highly exposed. We all have PFAS in our bloodstream, almost all of us. So think about your level of exposure and whether it can be very expensive. Medicare paid for mine for free, but private insurance companies can charge up to $600. They're really pricey. Clinical management by your health provider, depending on your levels, right? You're going to need an order from your doctor or your nurse practitioner to get a blood test. Once they come back, it'll tell you whether the levels are considered safe or not. And then you can go from there based on your own personal family history, any current health issues that you already have, to just track it and surveil it over time. And then finally, last but not least, risk reduction. All right. So first we have to know if we're at risk. This is the two slides that talk about the blood estimation tool. It asks you questions about your PFAS levels in your water and some demographic information. This link is in the resource page that I sent, and I probably shouldn't have made it a PDF. I'm just thinking about that, but all right. Tap water. So the first thing is it asks you about your tap water concentration. So if you have a well, you have to go ahead and get it tested. If you have public drinking water, then you can look at your annual water quality report. And then it takes you through things and it'll give you your results. It doesn't take long at all. So how do we reduce exposure otherwise? Well, drinking water is a major source. So the good news is, since I started doing this 11 plus years ago, you don't have to get a whole house water filter. You can get something that's on your counter that takes out a good number of the PFAS chemicals. In fact, that little, I don't know if you can see my cursor, that little wand there, you take the cap off, you stick it in the water, and it tells you how many parts per trillion you have in your water. And you can buy these at any store. Now, I have ewg.org. I'm very annoyed because they only have Amazon as a link to purchase these. You can buy them anywhere. And they're on sale right this week at a non-Amazon link. But anyway, the thing is, you always have to remember to change the water filter. If you're not changing the filter, you're drinking the same water as coming out your faucet, okay? So whether it's under the sink, whether it's whole house, whether it's on the counter or a water pitcher, you have to change the filter. And this little gizmo on this will light up, will tell you when it's too high. I have a whole house water filter and the lights go from green to red when I have to change the water filter, and I change it immediately. Okay. Avoid products when you can. One good law, and we're going to go through this in just a minute, Virginia has just passed, is that, and I mentioned it before, if there has to be a label that mentions if PFAS is being used in that product. If you are feeding your baby formula and your water's contaminated, you can use a filter thing like on the left here, or you can get pre-mixed formula. Check your local fish and wild game advisories, and this is not a joke, control dust at home. I hate dusting, but it is highly toxic, and even without the PFAS, there's other stuff in your dust. So control your dust in your house. They've done actually research studies on this. Okay, we're almost done. State responses. There's a great site called Safer States. The link is on the next slide. I just wanted to show you on the top here, they have states in the lead around certain chemicals, PFAS. That's what I search for here. They have a bill tracker. They have solutions, news. And we're doing okay. We have some adopted policies and some current policies, so we're okay. So quickly, biosolids and sludge. Um, some of these have been passed just this year. All of these have been passed just this year. Requires monthly testing of sewage sludge beginning January 1st of 2027. Another bill authorizes any locality to require testing and monitoring of PFAS when sewage sludge is applied to land. Personal care products prohibits the manufacture, sale, or delivery of products containing PFAS, requires manufacturers of menstrual products to label all ingredients. And for our water, requires PFAS monitoring and reporting for industries, industrial wastewater source that discharges pollutants. And it also, another law establishes the well water testing and treatment program. And
Laura,
yeah,
I hate to do this, but I have to break in there.
go ahead.
Wherever they got that information on water, that's inaccurate. There were
Oh, I was
bills.
hoping it was right. Oh
I
my
wish it
goodness.
was. There were bills that we strongly were supporting, but they
Right.
didn't make it through. So keep keep
Okay, that's good
keep
to know.
keep watching us. We'll help look for it next year.
Okay. Are both of these, the well water one, is that not passed either?
It did not,
It did not
unfortunately.
pass.
No.
Oh, okay. I'm going to write to them. Thank you, David. Okay, we're not doing as great as I thought. All right. So consider that it would cost up to $18 million to remove 1 pound of PFAS from wastewater. It only takes a very, very little to pollute at a level that is unsafe. All right. There are some promising research studies showing that microbial reduction of PFAS can happen by using certain bacteria, fungi, and/or algae to break down or sequester forever chemicals. They're also finding that there's electrochemical strategies that can also break down the carbon fluorine bond and other parts of the PFAS to help degrade it. As I mentioned earlier, prioritizing the phase out of non-essential PFAS in products is being done. Washington State is one of them that has put into law certain PFAS can't be used for certain textiles and food packaging and cosmetics. Keep in mind that as we introduce new PFAS, the newer alternatives can lead to similar health risks and should be used with caution. So in summary, there's widespread human exposure. Exposure in humans can affect many organ systems. Reduction or prevention is the best strategy, and blood testing is recommended for highly exposed. And that's it.
Thank you.
Buddy?
Yeah, thank you. So we definitely do have some questions.
Yeah.
Let's see where to start. So there were two comments on something that I wasn't at all aware of, which are solar panels. And one person said that they're greatly concerned about PFAS in solar installations. It's their understanding that solar panels are coated with PFAS and that the developers are not required to release the material safety data sheets in Virginia. And then there are these vast arrays blanketing hundreds of acres. What is the potential of them being a source of contamination? And then someone else also said, basically the same thing, that there's PFAS in the solar panels and that those panels are eventually going to wind up in landfills. And so should they be considered an exposure pathway?
To my knowledge, there's no protection in the development phase, the manufacturing phase, or what happens when they're done. In fact, when I had my whole house water filter changed just recently, I asked the fellow, the plumber, I said, where can I get rid of this? And he's like, well, just throw it out. And I'm like, no, I can't do that. You know? So we brought it to the landfill and they really didn't know what to do with it either. So that's a great question. I don't know the answer, David. I don't know if you've heard anything about the solar panels, but
Sorry, couldn't find my button. No, I'm afraid I haven't. The one possible thing could be if they're required to test their stormwater discharges, but I'm not even sure at this point if they qualify for that. So that's something to
yeah,
look into.
yeah. Great question. Thank you. I'm going to check it out when we get off.
Then someone was interested, well, there's sort of two hunting fishing questions. One was the
Mm.
risk of eating your local fish, and you sort of touched on that. Like, how do people find out if it's safe or not to fish in their local waters?
Uh, David, you want to answer that or you want me to answer it?
You can go at it, and if I
Okay.
think I have anything to add, I'll let you know.
Okay. Okay. Usually the Fish and Wildlife will post, it depends on what state you're in. And I was actually going to check it out again here. Um, the Fish and Wildlife Division will typically put maps of the streams that are polluted. Um, Go ahead.
Yeah, I think I can get more exact on what Virginia
Okay.
does. So Virginia has some fish monitoring around the state for PFAS, and actually you can find it. They have a whole dashboard for that. The most extensive places where they've sampled, unfortunately, they've found some pretty high levels in the Chickahominy River watershed
Right. Right.
and up there in the Occoquan area and streams leading to it. So the Virginia Health Department has a responsibility for
Right.
releasing what are called fish consumption advisories.
Yeah.
So for both of those areas, there are advisories. I will say though that probably the reason we don't have more around the state is we don't have more fish tissue monitoring.
Right.
And that's one of the things again that we're pushing for, that
Mhm.
we've got to look for it more widely and then know how to deal with it.
So I looked at the Virginia Department of Health website and was not impressed. Um, have you used it for the fish
Yeah,
advisory? You have?
I've
Okay.
spent a lot of time on their website and the
Okay.
DEQ, the Department of Environmental Quality.
DEQ,
Again,
right.
there's a fair amount of information, but it's not as widespread as it needs to be.
Yeah. Okay. Thanks, David.
Okay, then there's a couple of questions about filtration. And so basically, what sort, like, is it a specific filter for
Oh.
filtering out PFAS, or are some of the other water filters like you might have in your refrigerator or
Hmm.
like in your shower, do those work? And how do you
No.
know which is the
Yeah.
right?
Because it says what it filters out. And so NSF does a lot of testing on um, residential filters, and I believe that's also on the resource page. Um, the EWG.org and Northeastern University, the Project PFAS, also does reporting on uh, the filters. If you want really detailed, go to NSF. But no, your refrigerator filter does not take it out. And regular water pitchers, no. So the picture I had was zero water pitcher, and there are several more now that have been developed that you can buy, at any store, but it because it says what it will filter out, and not obviously there's 14,000 plus PFAS chemicals are not filtering out everything, but um, uh, you need to do a little research depending on whether or not you feel that you're being exposed highly through your drinking water. And That's a great question. Remember to change your filter.
Great. Um,
Rob is
okay.
asking, where's the research page? It's way up on the top of the chat box. Betty included it in the chat right before the session started.
We
There it is
also,
again.
Oh,
I
he
think we
shared it
can
again.
probably include it in our follow-up email.
Yeah, that sounds
Okay,
good.
great. Yeah. Um, okay, let's see. Oh, I was curious about this too. How did the deer wind up with high levels of PFAS? Is that known?
From drinking the water. And
Oh,
Yeah, and eating plants that have PFAS. If you watch any of the movies that I mentioned, Dark Waters or The Devil We Know, they show how the milk was polluted with PFAS because the cows were drinking the water that was coming from the industries that um, were, putting PFAS in the wastewater in the streams, um, and they were dying and people were drinking the milk and getting sick. So, if you're eating something that has PFAS in it or has had anything with PFAS that they ate, you're going to get it. So, yeah, that's how the deer got it.
okay. Then we've got two. So one is a specific one, which is that it was recently discovered that wintergreen was dumping sewage into the woods near their wastewater system. And the person wants to know if anyone's been tracking the potential PFAS coming off of that sewage. So that's, I guess, quite specific to wintergreen.
You want me to take a shot at that one?
If you have any,
Yeah. Well, any wastewater treatment system like that, first of all, I don't know anything specifically about that, but unfortunately, sewage treatment plants, which I guess is what that probably is, a small one, they're not being required to sample for PFAS at this time.
Right.
So whatever waste is coming out of it, whether it's going into a stream or somewhere else, they probably have no idea whether there's PFAS in it. Of course, if it's raw sewage that's going on the ground, it's bad, bad anyway. So there's lots more to be worried about there.
right? And then let's see, toothbrushes. Is that a
I don't
potential
know. I
source?
saw that pop up. I have no idea. I have no idea. I wish I could help on that one, and someone asked about Invisalign. I don't know. Um, I would I would imagine yes, but I don't know for sure.
Yeah. And then this is one that I don't know, potentially could be more of a Dave question. Considering the current political climate and apparent resistance to scientific research, would you recommend a moratorium on the application of biosolids to agricultural lands until such time as a safe level of PFAS can be determined?
Okay, well, one thing, first of all, yes, we can't depend on too much from an administration that has shown that it's not much interested in this kind of regulation. But we still have a state system and still quite a lot of authority for the state legislature and our DEQ to do something here. A good news is that we did get some bills passed this time that require monitoring of sewage sludge that's being land applied, require or set some thresholds for how much of certain kinds of PFAS can be in it. We don't think they're nearly as strong as they could be and need to be. So we and many other groups are going to continue to try to strengthen that. You know, the an immediate moratorium, I'll be honest, I the chance of that being adopted by Virginia or most states seems pretty slim. So we have to figure out what angles we can get through. And as I say, we got partway this year. We'll keep trying to push for better and stronger requirements in that way.
Okay, thanks. So I think we're just about out of time. There's one more that I missed, and I think you may have mentioned it, but how do people get a hold of their local water reports?
If you just do a search, annual water quality report. I live in Fairfax County. Fairfax County, it'll pop right up.
I think that under the Safe Drinking Water Act, they're required to send you some kind of
They are.
report with your bill like once
They
a
are.
year. So you should look, and if they're not doing that, make sure you let them know that you expect it.
They are, but most people throw them out. They don't even know what they are. Say, "Oh, is that what that was?" I'm like, "Yeah," but you can find it online. And if you can't find it online, just call your where you get your water, and they can send it to you. Great questions, everybody. Thank you.
Yes. Yeah, so thank you to Laura. Thank you to Dave and Kylie for being here. And thank you to all of you for being here to hear about this. And have a good night.
Thanks, Betty. Bye bye.
Goodbye.